and welcome to Rose's celebration of Black excellence in healthcare and healthcare technology. I'm Bertha Coombs. I'm a healthcare reporter at CNBC, and we've got an incredibly impressive lineup here of folks, a number of whom you probably already know, a number of them who've been celebrated in 40 under 40, which makes me feel incredibly old and incredibly unimaginative, but hopefully we'll be able to learn lots from them today. And I know that a lot of folks are very interested in hearing about their journeys. So I am not going to waste any more time. Let's get to the introductions. And guys, I'd like each one of you to talk about your company and your journey to founding. And among the questions that a lot of folks want to know is what's the most important habit and what's the most important process that has gotten you here? So let's start off with you, Gil. Addo, I think you are right now muted. That's what I'm seeing. So if everybody can unmute when it's their time to talk. Gil Addo is the co-founder of Rubicon, which tries to improve access for primary care doctors to be able to access specialists in order to treat their patients. So Gil, tell us about your company, your journey, and what do you think is the most important thing that's gotten you here?
Yes, of course. Well, first, thank you for having me, and thanks to the Road team for helping to coordinate and put this together, and thanks for everybody who's joined today. So I am Gil. I started a company called RubiconMD. We're a 7-year-old digital health platform on a mission to democratize access to medical expertise. We do that by providing a layer of support for primary care clinicians. So patients go to see primary care clinicians. Those clinicians can use our platform to get, at our core, text-based opinions, or what we call e-consults, from a network of specialists across the country, across 130 plus specialties and subspecialties. And the benefits are half the time the patients don't need to travel to go see the specialist, but you're also empowering the clinicians who know and support those patients to be able to get access to the right opinions within hours. So we're New York based, which means less now in our virtual world. We're venture backed. We raised a little bit over $40 million to date, and we support clinicians across 37 states. So excited to be here to share more about our journey. Most important habit. I think that I wish I'd been able to go after some of these folks, because they're going to dwarf me with their impressive. I think, for us, we've been fortunate to build connections with the right people who've elevated our business. And so I think being able to find the person who understands the space and understands what you're doing, and being able to figure out how to get in front of them. I don't know if that's a habit so much as kind of a muscle that we've built. And so I think that's been, key to our success. People don't default to the credibility of Gil, but they default to the credibility of the clinicians who support us, the investors who support us, the patients who get to experience the service. So I think finding those folks has been important.
Terrific. Toyin, co-founder of Cityblock, sending it to you.
Thank you. I've been looking forward to this so much, because I just like so many of my favorite people. So I'm just grateful for the opportunity to spend time with you all. I'm the co-founder and chief health officer of Cityblock Health. We are a just about 4-year-old provider whose mission is to transform the health of marginalized and low-income communities, block by block, hence the name. We do this by providing primary care, behavioral health, and social care in a tech-enabled environment for primarily Medicaid populations, as well as folks who are dually eligible for Medicare and Medicaid, who typically are individuals with some of the most complex needs in our healthcare system, who tend to fall through the cracks in traditional healthcare delivery modalities. And we've been now operating since 2017. We're live in 4 markets. We serve about 70,000 people, all of whom we take care of in a value-based arrangement with health insurers. So we're really incentivized to drive outcomes for them. We have about 600 people on our team. We're also a venture-backed company similar to Gil, and it's been a real journey. I think habits, I would say two habits, and actually that are also reflected in our values. One of our values at Cityblock is bring your whole self. And for us, that's really about radical inclusion, encouraging an environment that supports people showing up as they are. And in the last year of the pandemic and, our work from home and our juggling and the realities of all of the social impacts of the systems that we put in place that repeatedly fall short of our goals of equity, it's been so important to have space for people to bring that stuff with them and acknowledge it, as opposed to pretending that when we go to work, our lives are on pause. I think that's helped us build a really rich and rewarding culture, and it reflects in the way that our members, the folks that we serve, experience the Cityblock care team. I think your insides do reflect your outsides, and so that's been really important, and it of course requires modeling and vulnerability and willingness on the part of leaders to show up as they are as well. So that's been an important muscle to flex for me personally.
Especially these days, you show up as you are, and sometimes that means your kid is having trouble at school and you've got to help them out. Thanks, Dr. Melynda Barnes, who is the Chief Research, or I guess we'd call you Chief of Research for Roe. You're the in-house person.
Yeah, hi everyone, Dr. Melynda Barnes, SVP of Medical Affairs and Research at Roe. Roe is also on a mission to democratize access to healthcare by bringing healthcare directly to consumers, directly to patients. We do that through a couple of ways. So we have a vertically integrated platform where we write condition-specific online visits. We then have our own electronic medical record that we've created to further support physicians in their workflow. And then we have a network of nationwide pharmacies where we've also built that pharmacy fulfillment software. So directly going to the patients, physicians, and the pharmacy. We have Roman and Rory, our men's and women's health vertical. We have Zero for smoking cessation. And then we have a new business line, Roe Pharmacy, which is our $5 generics pharmacy. We have over 500 medications, all are $5 a month. And we do all this without adjudicating insurance. So putting the power into the patient's hands. The company launched in October of 2017. I joined them in November of 2018. We are also venture-backed. We are live in all 50 states plus DC. And we have 6 pharmacies throughout the country, and we'll have between 8 and 10 by the end of the year.
And what habit or
yeah, so similar to Toyin, I think 2 habits that we very push forward at Roe is, 1 is meeting patients at eye level, and 2 is always look under the rock. Those are 2 out of about 6 that we have. And I think that that's been something that I've done my entire career before coming to Roe, is as a physician, trying to meet my patients where they are. The medicine that the patient doesn't take will never help them. If I can't relate to them and get them to be advocates of their own health, then they'll never get better. And so working for a company that has that same principle has been wonderful. It's in alignment with my own values. And the same thing with always look under the rock. If you're not transparent, if you're not looking at the underbelly and looking at what's wrong, we can't fix it. And so as a company, we're looking at healthcare, we're saying how things can be better, and then using that as fuel and as our passion to improve healthcare.
All right. And we're meeting you where you are, at home with your family. And Dan, last but not least, you guys, you stand at the nexus of really trying to make that technology user face better. Tell us about Spora Health.
Yes, and thank you, Bertha, and thank you broadly to the Roe team for having me. As the youngest company on the panel, I'm definitely thankful for the inclusion for sure. And so my name is Dan Miller. I'm the founder and CEO of Spora Health. We are a primary care platform and practice uniquely designed for people of color. And so we focus on creating culturally competent experiences digitally and offline as well as providing access to culturally competent providers. And so we have, as Bertha mentioned, an amazing app experience that spans across mobile devices and web, which we believe will sort of decrease some of the emotive barriers and align with social, cultural, and linguistic norms of communities of color, and make sure that we can start to address a lot of the inequities and disparities that are present in the primary care interaction with providers. And so we came up with this idea sort of in the fall of 2019, and we were already working on this early last year. And with all that happened in 2020, sort of accelerated momentum for our business. We're also venture backed by some great investors. Our product's going to be live actually in 2 weeks now, and so we'll be available to see patients in 4 states. We have a wait list available right now for folks that want to join and be the first to be notified once we are live in their state. And we are growing, so we're also hiring for folks that are out there looking for jobs. And then lastly, in terms of habits that I personally have, I try to remain curious, especially within healthcare and sort of being an outsider. I studied economics in undergrad and have been a technologist and mostly in product and research and design. And transitioning towards operating within the healthcare industry and digital health, I've continued to question my assumptions that I have or why things are the way they are, and really sort of trying to, as much as possible, check what I believe I know about a specific system or function, et cetera. And then if I don't have that answer, trying to find access to that right information. And sometimes that leans into needing to do a lot of research and reading. Sometimes it means I need to lean into my network and just ask a lot of sort of quote unquote dumb questions. But that's allowed me to sort of make the jump and overcome a sort of steep learning curve. And I think allows me and my team broadly to remain competitive, not just now, but in the future as well.
So I want to pick up on that because sort of, I think a lot of us come at this and are here because we're part of the choir that thinks that technology can help create better access. Technology can help create a better continuum of care and really help us get at, particularly with patients with chronic conditions and who have had a hard time managing them, that technology can help sort of democratize that process to really help them. And yet I think about this year with the pandemic, to a certain extent, technology has been fantastic for people who know how to access it, to be able to go see and talk and confer with a doctor without having to leave the safety of their homes, to be able to get that prescription filled again without having to even necessarily pick up the phone and talk to a doctor. You can just send a message. Yet it also seems as though at times it has failed. I mean, I think about right now, the access to signing up for vaccines. It doesn't seem to be working or democratizing the process. It seems to be exacerbating some of the issues that we are trying to solve for. Have you thought about that, Dan, when you look at who's getting access to the vaccine, how everything is all technology based, and it seems as though the people who need it most are getting left out?
Yeah, absolutely. I've thought about this quite a bit. So specifically as it pertains to the vaccines, I think you're absolutely right. And the exacerbation that we're seeing, I think, is a function of a sort of a few things. But specifically, I think it's a function of how we are sharing access to information and how we're utilizing technology for things like managing inventory and availability and bookings, et cetera. And so this leans into systems that need to be available for large percentages of the population. And so for people that don't necessarily have great access to mobile technologies or broadband access of high quality or access to the right sources of information, they may be left behind for understanding when, how, and why they need to access these vaccines and broadly just health information.
Toyin,
No, I was going to say that's just a major assumption that we do need to address. But yeah, to your question.
Yeah, well, I'm wondering, Toyin, how are you handling it? You guys were very proactive at the beginning of the pandemic in terms of reaching out to your members, finding out how they were doing, sending them the PPE they needed. How are you reaching out now to make sure that they aren't left behind?
Yeah, I think so. It's hugely important, particularly when there's been such a highly politicized and really complex rollout as the vaccine, to recognize that we must be relying on trusted relationships to be the messengers for information, and that an equity-based framework requires us to invest differentially in the time, education, access, overcoming access barriers for communities that are marginalized, that are more likely to get left behind yet again, as we think about the impacts of this pandemic. And so for us, it's been about listening a lot, educating patiently, ensuring that we are raising our hands and creating access for our population, so that when folks want the vaccine, we're actually making sure that they have it available. And then overcoming access barriers. So all the things you talked about, do you have a smartphone to sign up? Could you have the flexibility in your day to go wait for hours and hours? A lot of our members don't have that. And so, all the way through to building processes that will enable us to bring vaccines to people's homes for folks who are homebound. Really overcoming those challenges and those barriers is critical. The other thing I would say is, to your earlier question about how has tech failed us or not failed us in this, I know Gil has done a lot of really interesting work here as well, and so I would love to call on him. But I think as a thesis, we know that that solutions built for the top 1% or for people with resources do not trickle down to folks who are marginalized. They never do. And so, from a 10,000 foot view, the premise of our company, I know of Gil's, of Dan's, really focusing in on the segment that we're trying to impact and building and designing for them and their needs is the only way to make sure that this wave of tech innovation doesn't leave us behind. And so that pervades through everything, right? And so I think it's no surprise we are where we are, and it takes a lot of really focused energy to build solutions that actually meet the needs of the population that you're seeking to serve, but instead of waiting for the rest of it to trickle down, because it won't.
Gil, I read an article where you said that you were solving for a problem that you understood with Rubicon. We understand this problem. How do you solve for this problem right now in terms of people who do not have that kind of access, who are not that 1%?
Yeah, I think that it was Melynda started with you have to meet people where they are, and I think that's the fundamental tenet here. And technology doesn't on its own lead to that. We spoke I think it was last summer when we started to see this incredible uptake in telehealth and telemedicine and everybody taking hold, that there was a problem that I think is the problem of COVID, which is the people who were already most vulnerable were being left behind. And I think some of it is what people talk about, and some of it is things that we're not talking about. So
like what?
The thing we talk about, the digital divide, we talk and think about it as the social determinants of telehealth. The same way you have social determinants of health, you're not going to be able to access a good telemedicine appointment if you don't have secure housing. Obviously, internet is a piece of it, devices are a piece of it, but all of those things that you actually need to have to enable you to be part of a telemedicine interaction, and that's on the patient side. And then there's a second piece that I think was less spoken about, but when you look at groups, and we we're a clinician facing tool, so we get a front row seat to all of, what's happening in this innovation. And you look at groups like Cityblock and Row as well, where they've actually went from, very, a base of already doing telemedicine, and they just ramped up, and they just ramped it up really quickly. And they won't tell me that it's easy, but it was relatively speaking easy because they built that infrastructure. And then I was speaking yesterday to a clinician who's was a primary care clinician in a community health center in Harlem, and they're being encouraged to stop doing telemedicine and to go back to in-person visits, and they have been. And when you think about what's at play there, it's not that that clinic supports the community and they care, and that is a community of color for sure. They're not bad people trying not to support them, but all of the financial incentives that are at play are making it really hard for them to be sustainable doing telemedicine. They don't have, the infrastructure of value-based care. And then at the time in which they should be investing in the technology and they should be building things like what Dan has built, it's being taken away from them.
In order to survive.
Yeah, and there's all these structural reasons around Medicaid and, more people being on it at the points at which the budget's being cut and all those things that are at play. But the safety net clinics that support these communities aren't receiving the same levels of investment in technology infrastructure that you're seeing in other parts. And that's scary to me. Like, to tell people that, you're then putting the patients at risk because they have to travel for in person. You're putting the clinicians at risk. There's all those things. And then the third piece is, I think, what we talked about a little bit, which is even if you put all this stuff together, you have to have people who are educated and engaged to do it. And we've seen all these solutions that just kind of assume if you build it, they will come. And I think the fundamental thing is you have to meet people where they are and assume that you have to educate them in a way that they can understand. And so I think education into the community about the services that are there, why you should take advantage of those services, how obviously you should take advantage of those services, and using existing channels, trusted resources. Nobody these days trusts the physician on TV, but they trust the one who knows them and understands them and where they've built the relationship in the community. So I think being able to meet people where they are from the community relationship perspective is, I think, the other key piece.
Melynda, I love that you talk about that. You guys aren't in the community. How do you feel that you create that kind of bond, and especially with people of color who may not necessarily think about going to a technology-based pharmacy, for example?
Yeah, that's a good question. We, on our research side, we did a study to see where are Row patients, and we published that we have served at least one patient in 98% of primary care deserts in the United States. So a lot of people feel that, this platform is just for wealthy urbanites, young professionals who know how to get online. But we've done a lot to try to get this into as many people's hands as possible. So a doctor's visit on our platform is $15. By having a huge nationwide pharmacy and nationwide practice, we can negotiate directly with the wholesalers for pharmaceuticals instead of working with PBMs. So in a lot of different markets, our cash pay price is at the same as what someone would pay out of pocket with their copay with insurance benefits. So when it comes to COVID, we launched the first telehealth assessment, which was completely free for patients to come through and see what their risk was. We have providers available to talk to patients who are at high risk. We also partnered with over 50 companies to bring this telehealth assessment to their employees. And our biggest partner was Uber, working directly with the drivers so that they could still be out there safely in the community. And we know that a lot of the Uber drivers are not your wealthy urban professionals.
And they may not even have healthcare insurance.
Absolutely. And our mission is to be able to provide people with healthcare without the need for insurance. You should not have to have a job to have healthcare. And if you meet the standards for Medicaid and Medicare, obviously that's a great safety net for a lot of people, but not everything is covered by that. And people want to have they want to be empowered to be advocates for themselves and for their healthcare. And I think what technology does, it allows us to scale that access so we can drop the price, so that we can get smartphones into everyone's home. We do a lot of work around educating policymakers around the benefits of telehealth, the benefits of doing store and forward or asynchronous care, so that you're not eliminated and marginalizing your already marginalized communities. If someone is living in an area where they don't have great broadband and you're mandating video visits, the people that you're trying to reach automatically can't be reached. And so just like helping to raise awareness around this, recently we acquired a company, WorkPath, that does in-home phlebotomy. So again, we feel like technology is a tool, but it's not the be all end all answer. You still have to go to where people are. And with WorkPath, we're able to now bridge the digital divide of like bringing care into the home, which may be a much better option for someone instead of having to get on the bus or the train to go to the hospital or to a clinic or schedule time off. They can schedule time to have someone come into their home, which when it's most convenient for them, which means they may not have to get childcare. They can continue doing what they need to do in the home. So I think we always say, look, we have to start somewhere. We started as a ED company for men. We now have, conditions and treatment options for men, women. We, have the WorkPath integration. We partner with Ribbon to get people connected to in-person providers, because we realize that for a lot of patients, they weren't deciding between Roe and their in-person provider. It was Roe or nothing else. And so now that they've connected with us, we're like, okay, you're 45. Have you had your colonoscopy? Have you had your lipids checked? Like, here's a provider in your area. Do you have insurance? No. Okay, here's a federally qualified health center in your area. And we're trying to be sort of that first touch point for people to get them reconnected to the healthcare system.
So on the one side, you guys are doing the good work and interacting with patients. But in order to do that, you also have to have funding to get where you are. I want to shift and talk a little bit about that part in terms of building your company, because I think a lot of people are very interested in that. And just how that has changed. Has it become any easier? Dan, you're the newbie with this particular company, but you had another company before that you did. And interestingly to me, you have, one of the biggest Black founders behind you, Arlen Hamilton. Is that something that has evolved? Does that make it easier to be able to get in and get that door open?
In terms of getting the door open, I'd say yes, most certainly. Over 2020, a lot of operations shifting to how we're communicating right now definitely enabled more efficient fundraisers and financing rounds.
So you didn't have to go fly to.
Yeah, exactly. And, I can fit in, if I really wanted to, 4 to 5, half an hour meetings, and still have like breaks in between, and still be able to, have those in-depth conversations and not have to commute anywhere. And so that's one thing. And I think that was beneficial for the entire ecosystem. Additionally, I think that provides more opportunities for folks in other geographies that aren't necessarily close to a lot of angel investors and VCs. I also think that it broadened the opportunity for a certain type of entrepreneur that might feel a bit more comfortable presenting in this mechanism versus in person. And again, going back to sort of a lot of the assumptions that are being placed on either patients or providers in certain environments, there are similar dynamics with investors and entrepreneurs specifically. And so if you're an entrepreneur that may be a bit more introverted, you have a great business opportunity, all of your numbers, you have a great team behind you, but you may suffer from social anxiety and presenting in person, you're not at an advantage with having to go down to Sand Hill Road and stand in front of folks and present your business. But you may feel a bit more confident in this sort of environment by yourself in your room, and that doesn't dilute the deal or the opportunity per se. It's just you're sort of aligning the entrepreneur's ability with their environment. And so for me, I'm one of those folks that it's a bit easier for me to go through presenting my business and my opportunity this way and be able to engage with all the investors that I've had to speak with. And that allowed us to increase momentum and be successful in raising our pre-seed round. And I'm super grateful for that, and most certainly all the investors that decide to back my vision as well as our broader teams. And I think that's we're going to see how this continues to manifest over time. I think for earlier sort of stage conversations, even as the world does continue to open up, I think we'll see more investors sort of leaning into, and entrepreneurs potentially leaning into having sort of virtual calls for initial conversations to see if there's alignment and personality fit and mission alignment with the firm and the entrepreneurs and the team. And then when you really need to dig a little deeper and really get to know the folks that you're going to be working with for a very long time potentially, that you sort of lean into if you can developing those offline relationships and learning a little bit more about one another, et cetera.
But the thing I wanted to get at, and Gil or Toyin, it often seems as though this whole VC route, I mean, I'm not in it, obviously, you guys have, trying to get a venture capitalist, trying to get that money, seems like you got to be a member of the club. How hard or is it getting better if you're not? It just always seems to me, I don't know, whenever you see like, here's the startup person, that startup person tends to be some young white guy, which is fine. People have great ideas, but I just wonder in terms about opening up in diversity, has that gotten any better? Has this past year, as a lot of people have talked about this issue more, made those doors a little open, a little easier to sort of at least get that appointment?
I can start here. I think the answer is yes. We closed a round of financing in February of 2020, so right before everything hit. So, what I was saying, it's better to be lucky than good, but frankly,
or both.
yeah, the markets are better now, and I think that we look around, there's financing rounds happening, regularly around the clock, and it might be some of what Dan's saying there. It's a more efficient set of interactions where you take out a lot of the personal and you're just looking at the business and able to have more interactions quickly with video. So I think that is a piece of it. Yeah, I think right now people understand systemic racism better than they did a year ago collectively. I think people are shining a light on it. I think people care, and I think people are willing to do the things necessary to go and find founders of color and other underrepresented founders and try to pull them up. And I think you could be cynical about that and say those people were always there and none of these things have changed. But I think it's I'm an entrepreneur, so I'm an optimist almost by definition. So I think there is a change, and I think it is great. More people, want to hear our voice on this, collectively on this panel. I think more people want to see people that look like us succeed. So absolutely, historically the norm and people pattern matched on a white guy in a hoodie, and that was how you fundraised. And it would, for the most part, people said no to RubiconMD who didn't invest because they didn't believe in the business. But there's a small subset of people where they didn't believe in us, and it's hard to tease those things out, but you can kind of sense when it's hard for people to get over that hump and to think that these folks can actually sell in this space. And I think that a lot of that is starting to change. It'll take time, but it's changing. And then I think the other thing that's changing, which is I think can't be discounted, is that the face of the capital that is changing. So people who are writing checks, there are more investors of color. Julian Harris, led our round from Deerfield and is somebody who's, incredible in the space and, brings, an incredible Rolodex. And so I think investors of color and investments in venture funds and people raising funds, supporting people of color and communities of color, I think is also changing the way in which fundraising happens. So I think all of the signs are hopeful in terms of people being more willing than they have ever been to deploy capital in founders of color.
And we've got some questions coming in, so I'm going to put this to
just
you.
A little color to that one, not to be the Debbie Downer,
Okay.
but I'll only believe it when I see the data is my answer, right? Like, there's been a lot of let's set up a side fund for early stage companies or founders of color. How much of that is new capital versus we just branded the old capital that we were deploying? I'm not sure. I'm curious about that. I spent a lot of time with very, very early stage entrepreneurs, particularly entrepreneurs of color, and the struggle is real. The hustle is real, and the bar to which they're being held, no doubt, is higher by virtue of that pattern matching. And so I just, I think it is a wonderful thing that we're talking about this more, and I think there's a wonderful thing that there is attention being paid, but I would caution us, particularly given just how deeply entrenched these social networks are that fuel so much of venture, to think that that simply paying attention to it is enough. I particularly think about what we know about unconscious bias and how deeply seated it is, and there's not a whole bunch of compelling data around the idea that just pointing the finger at it and shining the light on it then changes the dynamics, right? Like you would be fully correct to look at someone like me and say, does that person fit the profile I have of a founder of a wildly successful company, and think, not so much. I can't put my finger on it. I'm not sure why. And that's how humans make decisions every day, based on heuristics, right? So I think it's positive that we're talking about this. I worry that we might give people a pass for talking about it. I want to see the data, and we haven't yet seen any evidence to support the idea that more founders of color are being invested in. Partly we didn't measure it a whole lot before, so let's start actually seeing the outcomes here. I think it will take time for the entire ecosystem to start to change, such that the people writing the checks are also equally representative of the diversity of people out there with great ideas. That helps. But there's also really interesting evidence about, being an investor who is from a diverse background, either female or a person of color or both, and some of the social pressure they have to not go out on a limb and make a case for somebody who might not look like a traditional founder because they can't afford a loss, right? They're also on their way up the ladder. And so I think that dynamic becomes really complex, but my experience says we're having a lot of conversation. And there's a lot of social pressure and kind of global pressure to be seen to be doing something here. And also that it will take a really long time to undo, centuries of structural racism in our capitalist system, and to start to unpack some of the dynamics around institutional and lifetime and generational wealth that also play into the ability of people to show up and be entrepreneurs and to take risks, right? So there's a lot there, I think. And so I'm excited for where we're going, but I think there's a lot more to come.
Well, we've got a lot of questions here in the queue from the audience. Pienplin Guthrie, following on that, says he's working on is working on a startup to help people develop skills important for personal and professional success and health, such as emotional intelligence. The question: do you recommend bootstrapping as long as possible, or raise funding early on? What good products and innovations do you see in the mental health space in particular?
Can I just answer that? One piece is such an interesting insight, right? Who has the privilege to bootstrap their company, and where does that come from, right? And so yeah, sure. If you could, that would be a great way to go. I meet a lot of founders who can't, and who are beating the streets pre-revenue, trying to get somebody to buy into their idea because they don't have a network of friends and family or a bank account that will allow them to do this off the side of their desk or to quit their job to focus in on it, right? So it's hard to answer that question in abstract. But I think it's an important one, certainly, as we think about all of the different ways that people can get onto the path to entrepreneurship, and the ways that we can support a diversity of founders to be able to do that. Tons of stuff happening in the mental health space, and so I don't want to sort of take up too much airtime talking about that, but I'm super encouraged. I think that the COVID-19 pandemic has helped us normalize just talking about mental health in a way that as a society we hadn't before. And I think that's going to be helpful for starting to push for solutions that really, really drive outcomes, because this is we believe at Cityblock certainly that that there are 3 core pillars to health, and social health and well-being, and behavioral health and well-being, and physical health and well-being equally matter. And you don't get better by just piling on a bunch of healthcare for physical health without really understanding all of the other drivers that are going on for people. So I think there's a lot there. I think it's a really exciting space, and similarly a place where folks with diverse backgrounds and experiences building for different types of populations are necessary in order to ensure that we meaningfully drive outcomes.
And I just want to point out, we do have a side panel where you can ask questions, but there are a bunch already here. Ina Fadina, I'm hoping I pronounced it correctly, has a question about any thought on how a lot of digital health companies lack diversity in mid-senior level, and yet a number of them actually treat Black and brown people as their primary customer segment. For those of us in it, how can we continue to keep our head up?
I can start. So I think that it's obviously a fundamental problem, right? And I think there are people who target Black and brown people, but I think if you're in healthcare, and you look at the diseases that drive the costs in healthcare, and you go and tick through every single one of them, all the chronic conditions, diabetes, COPD, obesity, chronic kidney disease, you just go through them, COVID now, and then you look at who's disproportionately impacted. It's all communities and people of color. And so if you're in healthcare, then you support those, and that's the cost that you're trying to manage against. And so I think every company should be representative, because if you're making a real dent in costs in healthcare and doing real work, then you should be addressing challenges for those communities and for those people. So I think every company needs to be representative, not just ones that market that they target communities of color. And then I think one of the things I don't know about, I think keeping your head up is just saying that you're hopeful that it changes. I think the way to actually help is to do something that I've seen and been inspired by others who do, which is to, when there are roles, to pull people who you can into the room for those opportunities, and to continue to do that at all levels and in all parts of the organization. This is the age-old challenge. When you look at where diversity is, it doesn't permeate to the top layer, and I'm sure Melynda can speak more to this. And then it's not in certain part, like product and engineering teams don't have the same diversity as you see on other units of the organization. So being very intentional. And then one thing that we've been pretty big on at RubiconMD is, how do you make sure that you're measuring it? And so anybody that wants to see, we put out metrics, and we make sure that we look like the US Census at least, right? So we're, at the very least, we have representation across that census demographics, and that representation is at our board level, that representation is within the leadership, and that representation is in different functional units. So, and then I think, everybody that's in a company can push folks. This is, for better or worse, a moment where people care. And I think that's an opportunity to push people.
Yeah, I absolutely agree. We just had a meeting about this on Tuesday about our diversity, equity, inclusion efforts at Row. And just like Gil mentioned, it's harder to focus on the tech org, and that's the challenge that we took up. it's easier to say we'll bring in more diversity into other roles, but we do not believe that there is a pipeline problem. We don't believe that there's a lack of Black and brown engineers and product managers. But I think it goes exactly to what Toyin and Gil said, which is basically who is in your network. Personally, as a leader at Row, when I post a job on my LinkedIn, the applicants that come in from that look very different potentially than you'd set up when someone else posted. I have a very diverse team.
Not potentially.
I have a diverse team of, and people who interview with me say, I saw you on LinkedIn, or I saw you on a panel and I thought, I want to work for her. Like, this is amazing that there's a Black woman who's a physician who works for a high growth startup. Like, how did you get there? How can I be like you? And so I feel like we have,
answer that question. How did you get here? And how can they be like you? I mean, it seems as though a lot of it has to do with networking. And so networking with brown people so that you can say, hey, here's a candidate.
I mean, for me, I did not know anyone at Row when I applied for the position, but I think that I was very open-minded. I was very open to telling people what I wanted to do. I thought about it and I had a vision for myself and a mission for myself. And I knew the kind of company that I wanted to work for. And I also knew my own worth and value and did not want to settle for, a mid-level position just because I was a physician coming out of practice, wanting to go into industry. I knew that I wanted to work for a company that believed in me and wanted to support my ability to affect the vision of the company. They wanted to listen to the ideas that I had and be representative of women, of people of color. And so that was something that I was looking for. I think the other thing is like reaching out to people. I definitely cold emailed people on LinkedIn. And so when people do that to me, and the more I announce this, I a little bit start to regret it because my LinkedIn message floods. But I reached out to people and said, hi, look, you are the CEO of Aetna, or you're a senior medical director at Cigna. Like, how did you get there? How can I get there? This is what I would like to do. This is my background. And so, we talked about the importance of mentorship. Sometimes you don't have a mentor that's with you your entire career, but you have very targeted mentors who help you get to that next level. And so being able to reach out to people. So I think it's on us as well, if we are in these positions of leadership, to be open to talking to people who want help. If someone reaches out to you and they have, their CV and their message to you, they have targeted questions, like, can you take the 30 minutes to answer their questions? Can you pass along their resume? Can you give them some feedback on their resume and pass it along to other people? For this company, one of his HR people reached out to me, and I sent them a list of applicants that had applied for positions at Row, people that I knew in my network, and I made sure that it was a diverse group of people that I sent back to them to try to pass along. This person may not have been a good fit for us, but they're highly qualified, they're talented, and so you should take a look at them for your company as well. I think these are the things that we have to do, and as companies, as leaders in our companies, we have to push them to do this. And as Toyin said, we have to see the data. So, we look at our data and see, does our company look reflective of the population that we treat and of the US? And where it doesn't, that's what we're working on.
Speaking of data, Kai Butcher has a question here saying, do you feel your companies hugely affect the healthcare industry regarding gaining information on marginalized communities to be used in hospitals, pharmacies, et cetera, using this info and data sets to gain pertinent information to help patients in these spaces? I mean, we are at a time when there's a lot of discussion about getting this kind of data. Particularly of people who are in vulnerable and marginalized communities. Do you feel like you guys, because you are in companies that are pushing this agenda, are helping some of the big guys be more conscious of this and really working on these issues more?
I think if I can jump in really quickly, for us, we were thinking about using data for predicting risk profiles for certain chronic conditions that disproportionately impact Black Americans. So things that Gil mentioned, but hypertension, prediabetes, obesity, CKD, et cetera. And we're using that data to create a unique experience and solve for some of the unique challenges that people of color have to deal with when they're interacting with the healthcare system in the US and generally thinking about managing their health and wellness. But we're thinking about establishing baseline with our members and then using that as a metric to measure the sort of efficacy of the care model and the care experience that we're providing for our patients, and then helping that sort of guide the outcomes that we're driving. It's something that's really important for us at Spora Health, not just that example that I mentioned, but also just sort of trying to connect as much data as it relates to passive analytics, as well as some of the data that our patients share with us in effort to create better outcomes. Now, I think for us, we're also, since this is a sort of nascent thesis of care, we're thinking about making sure that to the extent that we can, that we're publishing this sort of research over time so that, in 9 months, 12 months, that we can, quantifiably prove that, this sort of thesis of culture-centered care is producing better outcomes for a specific population, which we believe and hope will persuade some of the larger players to think differently about how they're thinking about the care they're providing, but also just how they're thinking about allowing certain patients to search for providers. Typically in a lot of patient directories, you're not going to see things analogous to culture that folks need to filter on. So things like ethnicity. But we empirically know that not just ethnicity, but some other factors like gender in some cases and others can produce better outcomes for in a provider-patient relationship. But larger players are still a little slow to make those changes, and so we still need to do the work and the heavy lifting, and then publish sort of the findings, and then hopefully we'll be influencing them to make changes.
So as we're coming closer to the end here, I saw one question here, and now I can't find it, that I thought was interesting, talk about over the last 18 months, but I would say over the last year, particularly since it's been so challenging. What has been your best day? What has been the day when you felt like you really triumphed with trying to deal with the pandemic, trying to really get at patients, and what made that experience? The person wanted to hear first from Toyin and Melynda, so I suspect it was a woman asking who wanted to hear. Tell me when it worked for you.
I can go first. For me, it always comes back to knowing that we have provided really, truly exceptional, dignified, respectful care to people who wouldn't have otherwise had it. And so there have been actually many days, despite how hard the pandemic has been. There was a day when we were able to secure housing for a member of ours who has been in and out of the emergency room for many years, struggling with isolation and mental health challenges, and not having a trusted relationship with anyone or any advocate within the system to help her get housed. And those moments and those stories, honestly, that's what sustained me through COVID, was going to bed every night knowing that we're in the midst of this terrible pandemic. We have a large population of folks that we take care of in Brooklyn. This was early spring when we were just starting to see just how bad this was going to be. And there's a sort of ravaging through our communities, particularly communities of color, which is sort of the predominance of the folks that we serve are people of color. The only thing that got me to sleep at night was knowing that that despite this, all our members, the people that we're accountable for, were receiving absolutely the best care that could be found, honestly, in our community. We were providing them with person-centered care, with home-based care, with 24/7 follow-up, with true an experience that showed that they were valuable and that we weren't going to just like go down like that as things were going, things were turning out to be really difficult. And so that for me always is the thing that that feels like we're triumphing. And even amidst all of the other things, the funding and the growing the team and the what have you, it's like, do we know we're making an impact? And is that impact different because we exist? And feeling that and knowing that to be true has been really inspiring and motivating for me.
Melynda?
Yeah, similarly, I think, I was on maternity leave when our CEO, Zachariah, called me and said, hey, we got to do something with COVID. Like, what can we do? This was in March, and a group of maybe 20 of us got together, me virtually from home, and just over 4 days put together that free telehealth assessment for COVID-19. And I was proud when it went live and we had our first patients come through, because I saw the power of one technology, but the power of just like a collective group wanting to solve a problem. And that desire continues throughout our company. And like I said, we started with one condition, but our mission and our goal is just so much greater than that. And to have all these people come together to really push towards that, it just makes me very happy and proud to work at Ro. I think there have been, days throughout this past year where I've really just been happy. One is looking at my quality and safety team that we've grown, all women. We have women of color on the team, and just watching them kick butt, giving a presentation on how we're managing quality and safety at Ro. Just watching them walk through the numbers and the data and just thinking like, wow, a year ago, that was just me. And now we have this team that's just running things, and seeing more diversity of our new rowers, our new employees, across gender, across race, ethnicity, and just knowing that we're all coming together to push through. And of course, just like Toyin said, the days where we see, okay, look, we have this fundraising, or we have this many number of patients who have been treated today, we're really making a difference. We do a thing at Ro where we post every day a comment from a patient. And so it's just to keep us connected and grounded as to why we're here and what we're doing. And every day I get a little glimpse of just hope and seeing that connection of how we're actually positively improving patients' lives. And that keeps us going through the pandemic and through remote working and all of the other craziness that we've experienced in 2020.
All right, I'm going to call audible because there's such a great question here. So I'm going to give it to Gil and Dan as a way out, on our way out here. Stephen Felix says he's got a tech startup where their primary customers are persons with chronic conditions. They've built 2 mobile apps. Right now he's doing it part-time. He'd love to transition to doing it full-time. So he wonders, is it a good thing to seek funding mainly for expanding the team and paying full-time employees, and also for customer acquisition costs? When do you make that transition?
I'll give my take. I think I would, +1 to what Toyin said earlier. If you can, go longer, great. But the right time is the time at which you're starting to see the business inflect, and you need to take the capital to hit milestones. So what I would say, you need to, if you do think capital makes sense, there's 2 things I tell people. One is being all in is the catalyst for other people, coming on board, and that includes capital. When people see a capable, smart person has taken the opportunity cost and put their life and their time behind this, I think it catalyzes a lot of other things. So it's hard, and there are a lot of things behind that, but if you being all in helps other people get behind the business, and them putting their life behind it, and then knowing what you're raising the capital for. Certainly, like, you're going to grow the team, that's what capital enables, but to what end? You've got to hit milestones to be able to increase the value of the company, to be able to demonstrate growth for the investors. And so taking capital without a clear view of what you're moving towards and what the next milestone are is a risky proposition. So I would think and make sure that capital and taking it, you've thought through what you're going to do with it. But generally speaking, there's, if it feels right, this is the last thing I'll say. Nobody ever goes back and says, you know what, I'm really glad I never took that risk and tried that I've cared about and put my life into. But they will kick themselves if they didn't. So if it's the right time, without any additional context, go for it.
And Dan, you're the newbie on the block. You have had to make that decision more recently than anyone else.
Yeah. And so, making the transition from part-time to full-time, the way that I think about it is, try to stay in that part-time capacity if you need to, if you're bootstrapping your company, as long as you can, until you'll inevitably run into a bottleneck in which the most important input to get to the next phase is your time. But there's typically a point where you're still sort of exploring the product and confirming some assumptions and running experiments that you can get away with. There'll be long hours. You're essentially going to be working 2 jobs. You're working from when you wake up to when you go to sleep. But that's a function of the journey and working to create something that doesn't exist. And so but you have to be thoughtful about your time. And if you come to a point where you realize that the most important input for this company to get to the next phase is more time for me to actually execute on all these things that are clearly laid out, then you have a clear roadmap and decision that you need to make in terms of jumping out of the plane, as they say. In terms of bootstrapping to raising, it's a similar sort of dynamic in which if you can bootstrap, then by all means, absolutely do that. If you don't need to sell portions of your company, then and go through that entire process, then don't. But if you are in the scenario in which you need that capital to expound on some assumptions that you've proven out or experiments that have shown positive results, then you have a clear case for going and potentially raising a pre-seed and presenting your business to some other folks that may believe in the same sort of mission that you do, and if you can convince them of what you're working on, the problem that you're solving is worth it. But similar to what Gil mentioned, you also need to take into account that the amount of money that you're raising is to get to some sort of destination, and that is going to revolve around time to operate the business, to confirm some range of hypotheses, and then to achieve milestones to get to the next stage of the business. And so if you have all those things sort of clearly lined out, then and what it'll take to get to achieving that range of milestones, then you have an understanding of how you need to move forward, and then you have to go through the entire process of convincing folks to believe in you. But that's how I think about it. But generally, it's, as Gil mentioned, it's absolutely worth it. And if you're thinking about these things in depth, then you won't regret making the choice.
On that note, I've got to tell you, I am so impressed by all of you as someone who doesn't really have an entrepreneurial bone in her body. The fact that you guys have all been able to really move forward in these businesses and move forward as people of color and leaders of color in what is a very complex and difficult business of healthcare, to really try to help people in our communities is very impressive. I'm sorry that we didn't get to all of the questions. We'll see if we can forward some of them that are here. Maybe you can get a couple of answers that are written. But again, the theme today was celebrating Black excellence. And I think certainly these guys have shown why they are where they are and the leaders that they are. Thanks all for joining us. Thanks, Ro, for hosting this and for letting me have the privilege of talking with all of you today. Hope you're enjoying this month, and we'll see you again at some point.
Thank you.
Thanks, everybody.
Thank you.